A very good morning and a warm welcome to one and all present here. I, Hema Chetri from MPT second semester, Royal School of Medical and Allied Sciences, RGU, take the opportunity to moderate today's event on basics of ECG and its interpretation. Royal Global University is the fifth private university of Assam established in the year 2017. It is located on National Highway 37, opposite to Balaji Temple. It stands high with its virtues of excellence and a humble contribution to the society at large. RGU is a leading educational hub in northeastern region that maintains a particular commitment to exceptional UG, PG, and PhD programs under 27 different schools. Royal Global University stands to be recognized for its world-class infrastructure, cultural events, campus recruitment programs, activities, expert students, and also updated facilities. I warmly welcome you, sir. We are fortunate to have you today with us. We all look forward to hear from you. The speaker of today's event, Dr. Amal Sarma, sir, will elaborate more on the topic and enlighten us. With this note, I would like to introduce him. Dr. Sharma is a very skilled anesthesiologist currently working as Divisional Medical Officer in Divisional Railway Hospital, Lumding, since last 7 years. He pursued his UG from Guwahati Medical College and Hospital in the year 2009 and his diploma degree in anesthesiology from RG Kar Medical College and Hospital, Kolkata. He has worked as an intensivist in JNRC Dispur and as a full-time anesthesiologist in Varsha Nursing Home. He has also worked as senior resident and previously as CMP in anesthesiology in Central Hospital, South Eastern Railway, Garden Reach, Kolkata. He also has an experience as a junior resident in Department of Anesthesiology and Critical Care in RG Kar Medical College, Kolkata from 2012 to 2014. He has also worked as junior resident doctor in Namecare Hospital in the year 2009. In addition, Dr. Sharma sir has also presented a paper on comparison between regional and general anesthesia in shoulder arthroscopic surgery in National Conference Anesthesia in 2013. I would like to request the HOD, Department of Physiotherapy, Dr. Lopa Das, to kindly felicitate sir. Now, sir, mic is all yours.
All of you are from physiotherapy students? All of you? Other departments from? Radiology. So mostly are from physiotherapy. Okay, very good. Mostly final years or third year? Okay, good. I want to ask you, when you hear about ECG, what is the first thing that comes to your mind? Tell me. Heart. Good. Very good. Very good. Very good. Why it is called ECG? You know what is called ECG? Electrocardiogram. Okay. Why it is called ECG? Why? Just say anything. Any wildest thing. Any stupid thing. Go on. Come on. See, the word only signifies electrocardiogram. Is something related with the electricity. See, our heart has got some electricity. Very simple. Okay. One more organ we has got electricity. Tell me. Brain. In brain we pick up the electrical signal through EEG. In heart we call it ECG. Electrocardiogram. That means we measure the electrical activity of the heart and it is traced in a paper. We examine the paper, we come to a conclusion. See, ECG was discovered many years ago, long time back. In present time, we have so many sophisticated investigation in relation to the heart disease. But still, ECG comes as the first investigation for any cardiac disease. It is a very simple, but still, it is so much useful. Today only, also, we rely mostly on ECGs to come to any cardiac diagnosis. Okay. See, Definition: ECG or electrocardiogram in simple term is defined as graphical representation. In ECG you have seen this thing, na? Up, down, plus, minus something, na? Okay. Of the electrical activity of the heart, or algebraic sum of the electrical activity. See, electrical signals are going all around. We take a algebraic sum. We'll come to that, okay? So then we come to a conclusion and make a pinpoint diagnosis, okay? The machine is called electrocardiograph. So don't confuse, the machine we use it called electrocardiograph. You don't write anything. I will tell you what to write, and I will give the PPT also, okay? Don't waste your time. The original electrograph machine, it was discovered by Ithovan. Just remember this name, Ithovan, because we'll come to a diagram, which is called Ithogram's diagram, okay? So it was weighed more than 500 pounds. That means more than 250 kilo. Just imagine, it was 250 kilogram when it was discovered. Now we have ECG machine like this much, okay? Very small. In future you can expect in your mobile, maybe some app might be developed, you can do ECG instantly. Maybe putting some electrodes here, or maybe here also. Okay? How many of you have seen ECG being done in hospital? Okay. What did you see there? Just tell anything. Okay. Logazi DA, that is called electrodes. Okay. That is called electrodes. Why this is called 12 lead ECG? You don't know, this is called 12 lead ECG. It is called 12 lead ECG. Why it is called 12 lead ECG? Because it consists of 12 lead only. In an ECG paper, if you see, you will see 12 leads. We'll come to that: lead, unipolar leads, augmented leads, chase leads. Okay. If you total it, you will see 12 ECG leads. That's why it is called 12 lead ECG. Okay. Now see the what is called basic principles. See, these are theoretical and the physiological part. Until and unless you memorize it, it's very difficult. Eventually you will forget also. But most important thing to the ECG that you have to know how to read an ECG. Because you have to pass the exam first, definitely. ECG has got two perspectives. One, you have to pass the exam. In your practical exam, your examiner is going to ask you some questions about ECG. You have to pass the exam. Second part, you have to learn it for your life. By just ECG, looking at the ECG sometimes, you can save one human life. You know about pacemaker? Everyone, I'm sure. Everyone of knew pacemaker. You have heard it. You have seen it also. Maybe your family members, your neighbors. Any family members having pacemaker? Anyone? Or any relative? Any neighbors who has got pacemaker implanted? No one? No one? Yes. See, the diagnosis of a heart block when we give pacemaker is completely based on ECG. That means you are just doing a 200 rupees test and you come to a conclusion that this patient needs a pacemaker. Absolutely it is based on ECG. Okay, nothing else. Sometimes we need to do a Holter ECG. Holter ECG called 24-hour ECG monitoring. Okay, but the most important thing is just by doing a simple ECG, you can tell this patient needs a pacemaker. Okay, so this much ECG is important. Okay, in your life. See, when the depolarization wave spread through heart, depolarization, physiology, you have read. Anything, any idea about depolarization? Bolo, koi bolo. Bolo, say na, don't worry. You sit. You don't have to stand up, sit, tell, come on. Contraction of the heart. Anything else? Achha. No. This side? This side is silent. They're sleeping. See, depolarization actually it's a pure physiological thing. Okay. Here, when a depolarization wave means they're saying the movement of ions across a membrane. Okay. Sodium ion and potassium ions. They move across the membrane. Don't think it very deeply, okay? I'm just telling you. No one is going to ask you about depression. Even I was, when I am MBBS student, I didn't know anything about this thing. You won't believe, there are many doctors also, they do not know anything about ECG. You'd ask a gynecologist, he won't be able to say anything about ECG. In fact, it was only in my postgraduate days, I started to learn ECG, and I'm still learning. ECG is a big book. Even super specialties in cardiology, they are also learning ECG. You cannot finish ECG in your one life. But you have to know the basic rules, okay? That is more than enough. That is good enough for you. So when the depolarization waves spread through heart, electrical current pass, okay? When there's a movement of ions from one side to that side, that means actually what happens, sodium goes inside, potassium goes outside. Then action potential that is generated, that is moves, okay? That moves, and we pick up this difference, okay, that voltage through these electrodes, okay, and we trace it on a paper, okay, trace it on a paper. To understand the ECG, one should know about the physiology of conduction pathways. You know about conduction pathways, SA node, AV node, this thing, you have heard, na? Okay, I assume you know this thing. About the physiology of the action potential. And action potential is a rapid sequence of the changes in the voltage, okay? The membrane voltage or the potential. It is determined at any time by the relative ratio of the ions. I just told you ions means sodium and potassium, okay? Actually, action potential means it is the movement of the ions. Just remember that thing. See, you are familiar with this picture. How many of you familiar with this picture? How many of you seen this picture? Okay. What is this picture? Tell me. This is not heart, this is a cross section of the heart. Okay. This is a cross section of the heart. Pointer, pointer. No pointer, no? See, the first thing you can see SA node. SA node you can see. SA node is called the intrinsic pacemaker of the heart. Pacemaker, because it generates electrical signals. You know how to check our pulse. I'm sure each and every one of you. How do you check our pulse? How? Okay, where do you check? Radial artery. All of you know radial artery? No confusion? Yes, in adults, radial artery. Only in adults, not in children. Okay. You know, in comatose patient, in a cardiac arrest patient, which artery we check? See, at the time of ECG, we are discussing ECG. I am giving you some extra knowledge also. Okay, this is not related to ECG. Still, it's good for you only. Okay. What is the artery we check when a patient is unconscious? When a patient is? Yeah, very good. Why carotid artery? Why? Good, very good. Why carotid artery? What do you think? Bolo? Bolo, come on. See, carotid artery originates directly from the heart. Okay. We get a good pulse volume. The carotid artery caliber is very big. But peripheral artery is radial artery. That's why in a normal human being, we check radial artery. In a comatose patient, we check carotid artery. Okay? This much is here. Okay? See here, SA node generates electrical signal. You can see there. That is called right atrium. Okay? That is right atrium. So from SA node, the signal moves to AV node. You can see there. From AV node, it goes through bundle of His. That means bundle of His connects these two bundles, left and right. SA node to AV node. From AV node, it goes through bundle of His. You have to remember these names. Okay? And this is very important also. This diagram you have to keep tip of your tongue. This is very important. From SA node, it goes to AV node, then bundle of His, then left and right. Because in ECG, you will often come across a word, left bundle branch block, right bundle branch block. These terminologies are very common. Even in normal human being also, even me also sometimes, you also you'll find RBBB, right bundle branch block. Right bundle means that right bundle, you can see there. Can you see? Right bundle. Left side also left bundle, but it has got two part, anterior and posterior division. Then the small fibers, Purkinje fibers. So these words you have to remember. Okay? Clear? कोई confusion है? Ask, any confusion? No confusion? Good. See, these are the information we will derive from an ECG. What do you see in the first? Heart rate. Second is heart axis, heart rhythm. See, first point, second point, third point. These are the most important points. In exam, your examiner first will ask you these 3 points. If you can answer these 3 points, you will get very good marks. If you don't answer also, it's okay, but at least heart rate axis and rhythm you should know here, okay? You have to know this thing. Third point comes myopathies, carditis. These are less common, okay? I am telling from an exam perspective, okay? Learning ECG is a kind of, process. You have to make this habit. Whenever you see an ECG, you go and snatch the ECG, you see. This is not about theory. You have read so many theory topics, you have attended so many theory classes. This is not at all about theory. I am sure theory question is not from ECG. कोई question आता है ECG से theory question? Very rarely I think, very rare. It is only about the exam, practical exam. You always try to make this habit. You know, जिसको बोला होगा आज मैंने एक तो ECG किया है, आज मेरे अंकल का ECG हुआ है. You go and see the ECG. I will tell you how to see, what to see. But make this habit. You have to develop this habit of reading an ECG. The more you see the ECG, more you will learn. Then only you will develop the interest. You read this topic today, you go home and sleep. You will just, before the exam you will read. It's not going to give you any good impression regarding ECG. Okay, you have to develop a very good habit. Then chamber hypertrophy, conduction defects, myocardial ischemia. We will consider this in later part. Now see this ECG. Instead of K, they are written C, it's K, na? Spelling is wrong. I think it's a European, most probably. Just see the diagram first, then I will come to that. I'm sure you have seen ECG. See, ECG is consist of these parts. It has got few waves, it has got segments, it has got intervals. Okay. So whenever you see an ECG, the first thing you will see is small positive wave that is called P. Why I am saying this positive? Because that is above the line. That line is called isoelectric line. This write this down, this line, isoelectric line. Isoelectric line. Iso means same. That means that electricity is neutral there. Okay, isoelectric line. Isoelectric line is considered in terms of positive and negative deflection. See, you can see the P wave, all of you? All of you? Okay. P wave is, tell me it's positive or negative. Positive, it's as simple as that. Now, next comes the PR interval. Okay. Every part has got clinical importance. That means you can find so many diseases by looking at the abnormal P wave. This P wave is normal, but sometimes it is possible PF could be very big, PF could be very small, PF could be absent. Okay, PF could be present, but you can't see it. It is embedded in the QRS complex. So there are so many pathophysiologists. Okay, so that's why each and every part is important. But for you, again I will tell you which is important at this level, in your level, okay? So P wave is followed by PR segment, okay? Before that, PR interval, okay? Then you can see the Q wave. Can you see? Q wave is here negative. No confusion. Q wave is negative. Then comes the R wave, or you can say the QRS complex. All of you can see. देख सकते हो आप लोग सभी? QRS complex. QRS complex will need when we will be studying about the axis, okay, cardiac axis. Just see QRS complex here is positive, which is followed by ST segment. Can anyone tell me what is the importance of ST segment? It's very important, extremely important in your day-to-day life. You have seen in movies, Facebook, Twitter, everywhere. Not exactly ST segment, but something very close to ST segment. Definitely, how will you say ST segment? But something very important on cardiac disease, which is related with ST segment. Can anyone tell me? Chalo, bolo. Chalo, it's quite close. Quite close. It is actually. Yes, very good. Myocardial infarction, ischemic heart disease. To be very proper, coronary artery disease or acute coronary syndrome. Very good. ST segment, there are so many variations. Okay. If you know how to see the ST segment, you will 100%. You will diagnose a case of acute myocardial infarction, acute coronary angina, coronary artery disease, unstable angina, something related with the ischemic heart disease. Very good. Then comes the T wave. T wave has got many important factors. You can write this down. ST segment is important in diagnosing. In your exam, your examiner might ask you what is the importance of ST segment. Just immediately, you just tell ischemic heart disease or coronary CAD, coronary artery disease. You can see below QT interval also. QT interval, it is required, in those who are studying cardiology actually. Okay, QT interval, you don't have to know, but still I will tell you, in some drug toxicity, we check QT interval, okay? In some drugs we use in cardiac diseases. T wave importance in electrolyte imbalance. Okay, don't write so much, okay? Don't write. I'm telling you to write few things because just before going to exam, suppose tomorrow you have practical exam, just before going exam, you just go through this page. Just one page, it will help you in the exam, okay? See, this is a normal 12 lead ECG. All of you can see there, 12 lead ECG. You count the leads. How many leads are there? 12. You start from the AVL. AVL is called augmented leads, okay? It is followed by lead 1. See, this leads, starting with A. These are called augmented leads, okay? This is called augmented leads. This could be also exam question. They might ask you what is called augmented leads. Augmented leads are AVL, AVR and AVF, okay? Then comes limb leads. Limb leads, lead 1, lead 2 and lead 3. These are, this looks very basic, but in exam, you fumble with these things only. See, exam in practical exams are never tough. Why students fail? Because they make fumble in answering very simple questions. Okay, in practical exams, we have seen so many practical exam prepared. They are actually not tough. You make mistake in very small things. Now I'm telling you, it seems like it's a very simple thing, na? Lead 1, lead 2, so what is there to remember? But in exam only, you will make fumble. Okay, just try to recollect it in your memory here only. Okay, just यही सब confusion आप clear करो. Lead 1, lead 2, lead 3 are called limb leads. Lead V1 to V6 are called, what is that? Chest leads or bolo precordial leads. Okay, precordial leads or chest leads. Limb leads. L means limb. Okay. A means augmented. A means augmented. L means lead, limb leads. And P1 to P6 chest leads or precordial leads. See here we can see P1 to P6, but sometimes we may have V7, V8 also. When we want to see the backside of the heart, that means posterior infarct. Myocardial infarction could be different types. It could involve the whole heart, different parts of the heart. When it is involved the posterior MI, posterior infarction, we put 2 extra leads on the backside. That is called V7, V8. Normally we don't do it, but when you are sure that this patient might be having posterior wall infarction, then we'll use V7 and V8. Okay, this much is clear. Any confusion? Any confusion? No? No confusion, na? Should I ask you a few questions then? Bolo. Should I ask? I will ask later, okay? Later on I will ask. So now you tell me about the non-cardiac disease. See, when ECG comes to your mind, the first thing we think it is the heart disease. Yes, isn't it? ECG means heart disease. But sometimes, practically also I'm saying, in ECG we can use to diagnose non-cardiac disease also. This is very important. Because even I also thought long time back, ECG means heart disease. No. At least 10-20% cases, at least I can tell you potassium abnormality, hyperkalemia, hypokalemia. Okay. This condition easily diagnosed by doing an ECG. I told you not T wave. Can you remember T wave before? This T wave. By examining the T wave, you can diagnose hyperkalemia and hypokalemia. T wave is this much important. When the hyperkalemia is there, T wave is like this, tall building. Okay, like a royal building, this big. Okay, and when the hypokalemia, it will like flat. When you see tall and tainted T waves, that is diagnostic of hyperkalemia. If you ever come to, work as in, ICU, cardiac setup, CCCU, ICCU, you will see there. Doing APG machine, APG machine is there, and you match it. Suppose the patient has a potassium, like very high potassium level. You have seen the ECG also. You will 100% tell this patient is having hyperkalemia, and hyperkalemia is a severe life-threatening condition. Patient will immediately go into cardiac arrest. Immediately. Okay. So this is very important. See, there are other conditions also, hypothermia, CPA, pulmonary embolism. These are not very important last points. So this part is a little bit boring actually. I'm sure you are not going into sleep. This part really very boring. Okay. You don't have to remember, just go through these lines. P wave due to atrial depolarization. Atrium you know na? Atrium ventricle. Huh? I'm not going to physiology of heart. I assume you know about atrium ventricle, this thing. Okay, you all of you know, I'm sure. So due to atrial depolarization. Okay. P wave is recorded before the onset of atrial systole. Okay. QRS complex. QRS complex is important. Okay. Due to ventricular depolarization. T wave, I don't know why I've written this. Anyway, Q wave is due to depolarization of the interventricular septum. You have come across this word depolarization very frequently. You go and read about depolarization. It's a small topic in physiology. Hey, are you feeling asleep or what? नींद लग रहा है क्या? नहीं ना? R wave due to depolarization of the ventricles. QRS complex is recorded before the onset of the ventricular systole. You just try to remember P wave, QRS complex, okay, and Q wave. These are a little bit important, okay. QRS complex will diagnose so many diseases by using the QRS complex. These are called waveforms and intervals. T wave due to ventricular repolarization. When the depolarization finishes, then starts the repolarization. Okay, that means the ions that used to move across the membrane, sodium and potassium, this will again come to their original place. Okay, that is called repolarization. Means in a very simple term. Then wave, one wave they have mentioned as T wave. We have already discussed. Okay. Then comes the U wave. U wave is actually not a normal physiological wave. That means in a normal ECG, you are not going to see U wave. Only in pathological condition. What is that pathological condition? Hypokalemia. Okay. That is only one condition. You can write pathological U wave, hypokalemia. Just one line. I am not very sure this is an exam question or not, but if ever someone asks you this question and if you answer this, I'm sure that will give you 100% marks. Okay? You will get an honors mark for this. Not honors mark, I don't know, you will get full marks. In severe hypokalemia, you will see pathological U wave. Just write whatever only I have told you, because at the end of the class, you will have lots of things to read. Only you have confusion. For exam purpose, I am telling you, okay, just write one page only, so that you have to read other things also, no? Before exam, you will have lots of things. Just make these small points, whatever I tell you. Various intervals. Various intervals, one was PR interval, isn't it? PR interval. Don't write. No need to write. And QT interval. Just two intervals. PR and QT. Okay. Then comes RR. RR interval. RR interval I am not discuss now. When we will discuss about the heart rate. When we calculate about the heart rate, then we will discuss about the RR interval. That is important. Okay. What is the normal PR interval? That is 120 to 200 millisecond. So you will ask me what is called millisecond, what is 120, 140, 200, 160, 110, what is that? I will tell you. For that you will have to see the ECG. QT interval 400 millisecond. See, ST segment. Okay. This segment, all ventricular muscle are completely depolarized. ST segment is one of the most important part. I will show you where the ST segment is. Can you see at the end of the QRS complex, there one straight line, then comes the T wave. That means S and T wave के बीच में जो एक straight line है. Normally that is also called, उसका एक नाम है. Can anyone tell me? ST segment, one alternate name is there. J point. J point. J point elevation. Sometimes they might ask you, what is J point? They won't ask you ST segment. Then you will be confused. Sarma sir तो नहीं बोला. J point is also called ST segment. ST segment is also called J point. Okay, they are same. Both are absolutely same. Don't write. Just One word only. J point means ST segment. See, it is also isoelectric. Isoelectric, I told you, na? Starting. So straight line hota hai, it is isoelectric. That means neither is above the line or below the line. That means it is isoelectric. So in ST segment, it could be elevated also, it could be depressed also. Okay, both are the possibilities. Then comes the QRS complex. QRS complex again I will show you. See the QRS complex. Can you all see? You have water? QRS complex. Tom-like structure, na? See, in ECG, looking at the ECG only, you can tell which is QRS complex. It is tall. See, sometimes QRS complex could be negative also. Then you will become confused. This is above the isoelectric line. Okay. It could be below the isoelectric line also. It could be negative also. Or you can say positive deflection or negative deflection. Understood? Okay. Not axis, isoelectric line. Yes, yes, ऊपर ही होगा. Then you will say 12 lead है ना? We have 12 leads. Every lead could be different. Different means two option only, either ऊपर or नीचे. Okay, we'll discuss it. We'll see about the, cardiac axis. Now we come about the importance of QRS complex. We have discussed about the importance of ST segment. All of you? Confusion, last line? You can hear me, na? Can you hear? Audible, na? Okay. Now we'll discuss about the importance of QRS complex. You feel little bit boring because we are not coming to the real ECG. We'll discuss about this ECG, na? Then it might be little bit interesting for you. Okay. So QRS complex is important for diagnosing different types of tachyarrhythmias or bradyarrhythmias or simply arrhythmias. QRS complex is required for diagnosing arrhythmias. Now I want to ask you what is called arrhythmias. Just it's a one letter word also, two letter word also. Arrhythmias. What is called arrhythmias? Huh? Irregular heartbeats. No. बोलो आप लोग बोलो एरिथमिया सुना है हैव यू एवर हर्ड दिस वर्ड एरिथमिया एरिथमिया इसको तो एरिथमिया हो गया वैलेंटाइंस डे के दिन ही हैज गॉट एरिथमिया हैं नोबडी टोल्ड यू rhythm of the heartbeats yes quite close arrhythmia means abnormal heart rhythm. Now you tell me what is called rhythm. बोलो rhythm. What is rhythm? हम लोग बोलते हैं ना ये rhythm में bowling कर रहा है good rhythm. Why do you call rhythm? You heard this word in ECG ना cardiac rhythm, heart rhythm. Why it is called rhythm? What is the meaning of rhythm? बोलो आप लोग anyone? Rhythm means whether it's irregular or not. Okay? Rhythm means whether it's irregular or not. That means you see your pulse, check it. All of you check your pulse. All of you check. I will tell you. There is reason for that. Check karo apna pulse. You all check for 30 seconds. Check for 30 seconds. I will tell you. Even for a layman also, they can tell me these two things, rate and rhythm, just by pulse. So simple. So when you are checking your pulse, what do you feel? What is the inference you have got? Conclusion. Bolo. Huh? Rhythmic movements. Okay. What about the rate? Is it not important? Hmm? Rate is not important. What is the normal heart rate? Huh? What is your heart rate? I am asking your heart rate. That's why I told you, 30 seconds. How much you got in 30 seconds? Again, around 68. In 30 seconds, how much heartbeat you got? You didn't count. That's why I asked you. That's why I asked you to check your heart rate. That means none of you counted your heart rate. Isn't it? Anyone counted your heart rate? Kaun count kya? You count. How much you got? In 30 seconds, how much you got? Tell me. 32. That means your heart rate per minute, how much? Do you go to gym? Tell me, do you go to gym? Yes. There is a reason for that. Why did you ask you? Why did I ask you that? That means by checking at your pulse, you come to two conclusions. First thing, rate. What was the first thing we were looking at the ECG? Heart rate. All clear? All of you got this point? When we were looking at the findings of an ECG, I told you rate, rhythm, axis. Okay? Exactly, that is what I am telling you. By looking at the pulse, you have checked your heart rate. Okay? Heart rate, you have counted it. Though you didn't count, you have counted it. It could be 60 also, it could be 70 also, it could be 80 also, it could be high also. One more thing, tell me. Tell me, come on, now you have to tell me this thing. First thing is rate, second thing you tell me. Anyone is welcome. Huh? What? Pressure? What pressure? What pressure? मोबाइल में चेक करो ऐसे बोलो huh? Yes, heart rhythm. What is heart rhythm? Say एकदम simple से बोलो very simple. That is the rate only. एक मिनट में कितना बीट कर रहा है? That is the rate thing, rate only ना? That is about the rate. Rhythm. Rhythm means what? Your heart rate is regular or not? You have checked that also unconsciously. You have checked, but you are not able to comprehend it. You are checking your heart rate for 1 minute. You have counted it. Your heart rate is, let us assume, is 70. Is it regular? I am sure all of you have got regular heartbeat. Again you check. Just check for 2 seconds only or 5 seconds. Could feel karo. Is it coming regularly, your heartbeat? Definitely yes. Otherwise you won't be sitting here. You'll be in hospital only. Isn't it? That means just by looking at your pulse, you can tell heart rate and heart rhythm. That is exactly we'll confirm by looking at the ECG, means the strip of paper. Okay? These two things, without the ECG also, in a man who is lying there, who is unconscious, who is in a hospital, always try to make this habit. कोई patient को approach किया, just see his pulse. You have seen that doctors or anywhere looking at the pulse. By looking at the pulse, he is seeing the rate and he is seeing the what? All of you say? Rhythm. That means whether the beats are coming regularly or not. Okay? That means when you see an ECG, have you seen anyone ECG? No, no. It is written normally NSR. You have seen this word NSR. That means normal sinus rhythm. Sinus rhythm means regular. That means all of us are having our cardiac means heart rate in sinus rhythm. In exam, your examiner will ask you what is called sinus rhythm. You will think sinus rhythm to nahi bola tha sir ne. Sir ne to only rhythm bola tha. Huh? What is this thing rhythm, sinus rhythm? Sinus rhythm means your heart rate is absolutely regular. Okay? Any confusion? No confusion? Sure? Exam में भूल नहीं करेगा तो? These things you have gone through, okay? Normal, unipolar limb leads, bipolar leads, this thing, precordial. See the importance of ECG leads. The ECG lead placement, different types of leads is different types of inferences. Every lead has got some physiological importance. That means it reflects some part of the heart. Precordial leads, V1 to V6, then augmented leads or limb leads. Okay. By looking at the abnormality of that particular lead, suppose chest lead, precordial lead, for example, precordial lead V1 to V6. Just by looking at the V1 to V6, we can make some diagnosis. Or you can say some problem might be there in this part of the heart. Our heart is like this fist. Okay? Our heart is like a fist. It has got apex, it has got border, it has got four chambers. Okay? Valves, anterior valve, posterior valve, base, interventricular septum. Okay? This leads exactly represents health of that particular part of the heart. Okay, you see there first. Inferior valve, lead 2, 3 AVF. That means lead 1, lead 2 होता है ना, lead 2, 3 AVF. AVF is augmented. Okay. See lateral valve, lead 1 and lead 2. Lateral valve also, I think inferior valve also, both. Okay. But see, I think mostly it's the inferior valve. Just remember, you can write this down. Just make small points. Small point. Inferior valve, sorry. Inferior lead 2, 3 AVF. Lateral valve. Sorry, I made a mistake actually. It's okay only. Lead 1, lead AVL, lateral valve. You don't write septal, anterior, lateral. Don't write. It will make you confused only. Just write first 2 points only. I will tell you what. Why inferior valve I am telling you? In myocardial infarction, inferior valve ischemia is the most common. In myocardial infarction, suppose you have heard that some of your relatives, father or mother or anyone has undergone angioplasty. You have heard this word angioplasty? Bypass surgery. Bypass surgery सुना होगा? हाँ? We went to Chennai, we went to Delhi, वो तो bypass surgery करा के आया. Patient का condition अच्छा नहीं है, bypass surgery. So this inferior valve ischemia is one of the most common cause for that. Chest pain होता है? Chest pain हुआ, बोला उसको तो heart attack हो गया, तो inferior valve ischemia, that is the most common thing for bypass surgery or angioplasty. Two different things. Angioplasty you put some stent. You have heard ना stent? Stent दे दिया उसको तो 2 stent दे दिया, 3 stent दे दिया, उसका condition बहुत खराब है. That is called angioplasty. Angioplasty, or you can say PCI. And another is bypass surgery. Also you can say CABG, coronary artery bypass graft. That means this blocked vessel we bypass it. Suppose highway में काम चल रहा है, we make an alternate way. Shortcut चला जाएगा side से, isn't it? Exactly, that is the same thing. Coronary artery bypass grafting. We take a vessel from a limb and we put it, implant it to make a bypass channel so that the blood flow is restored. Okay? So inferior valve ischemia is a most common. It is one of the most common cause of acute MI. Okay? Acute myocardial infarction. Then lateral also, lead 1 and AVL. When you remember this, you have to remember as a whole, lead 2, 3 AVF. Okay, lead 2, 3 AVF. You see at the same time. That's why they are called contiguous leads. That means they are in a one group. Like this is one group. Okay, suppose this is inferior valve, this part. Okay, this is lateral valve, one group. So all members here you can say contiguous. Contiguous. Okay. No confusion? ठीक है ना? Then comes V1, V2, V3, V4. Don't write this. After 1 month, you will have confusion. Now you will feel that you know everything, you can remember everything, but it will be confusing only. Axis will come later. Now from ECG, we are going to see how do we calculate heart rate and rhythm. Can anyone tell me how to check the heart rate by ECG? No problem, I'm just asking. It's okay if you don't know, I'm there to tell you. Anyone? Bolo. Where? Hmm? What do you count? I told you one interval. Can you remember? One interval I told you. RR interval. Okay? RR interval. Now I want you to see this ECG. Okay, I have this plain ECG also, I will tell you. But I want you all to see this ECG. What do you see in this ECG? Just see this. It's एकदम simple ECG. कोई heart disease नहीं है उसको. No diagnosis. Just see this ECG. What do you think? See. First we'll go heart rate. Now can you see the RR intervals? If we had a pointer it would have been good. Can you see the RR intervals? This is R wave. Can you remember the R wave? Wait, I will tell you. Show you. See. R wave. Okay. Can you see the R wave? You need a break or what? Do you need a break? 5 minutes break? You need? Do you need? You need 5 minutes break? Okay, take a 5-minute break. Do you know what is the lead that we check? Which strip? We have got 12 lead, na? 1 to 12. So calculate the heart rate and the heart rhythm. We need one very important lead. That is called lead 2. Lead 2 is very important. And lead 2 is called rhythm strip. That is also called rhythm strip. So just you can write this point. Lead 2 is also called rhythm strip. So by using the lead 2, we'll calculate the heart rate and the heart rhythm. Rhythm we don't have to calculate, just looking at this thing only, we can see whether rhythm is regular or not. Normally in a ideal ECG, okay, if the ECG is very good, if the ECG is recorded by experienced technician, you will see a separate long lead 2. Here can you see long lead 2 very, means in a where it's printed separately, we have a long strip, long reading. It's normal only in this thing. But I have one ECG. Very separately so that we can calculate the heart rate and the rhythm easily. Here it's not there. Still, you see the lead 2. Significantly, we will use only this lead to see the heart rate. Now, how do you calculate the heart rate? There is one very simple formula. See, this constitutes one heartbeat. You know that this is equal to one heartbeat. That means one complex P wave is there, PR interval, okay. Then QRS complex, then comp ST segment, okay. then this is the T wave. All clear? No confusion? But this and this part, this is called RR interval. That means 2 consecutive RR interval. First, you see this thing. Okay? Now, how many boxes can you see here? Large boxes. 4. 4.5 something. Not 5 also, not 4 also, isn't it? 4.5, okay. Now, you have to divide 300 by, let us assume this is 4, okay? Let us assume this is 4. Now divide 300 by 4. How much you got? 75. Exactly, that is the heart rate. Okay, you write this down. 300 divided by number of large boxes in a consecutive RR interval. This point you write. 300 divided by number of large boxes. Any confusion? No confusion. It's as simple as that. Provided the heart rhythm is regular. That means the heart is beating in a regular way. Suppose this consecutive RR interval is not same. Somewhere it's 4 boxes, somewhere it might be 6 boxes. It is not regular. That means your heart is not beating regularly. These two guys has missed it. These two fellows have missed very important point. Okay, I will tell you for again. Okay. No more students outside. Anyone outside? See, if you miss this point, it's a big miss actually. Okay. You've just missed a free hit. Again, I will tell you. Number of small boxes, large boxes between consecutive RR interval. We are discussing about the calculating the heart rate. Okay, how do we calculate the heart rate? Because in exam, your examiner will give you an ECG strip, and the first thing he will ask you, calculate the heart rate. Okay, calculate the heart rate, and immediately you will see the lead 2. Lead 2 is called rhythm strip. Okay, you will see the lead 2, and lead 2 you will see the RR interval. There is nothing to fumble. Okay, no confusion at all. So you see the number of boxes, 1, 2, 3, 4, 5. Let us see 4 also, 5 also. Let us see 5, okay, 5. So 300 divided by number of large boxes. That comes to 60. That means heart rate is 60. But if the heart rate is not regular, can you tell me one condition when heart rate is irregular? Irregular heart rate. It's fast, it's irregular. Anyone? Anyone tell me? Come on. Tachycardia means what? Tachycardia means what? Heart rate is fast. But nowhere it's mentioned irregular. It has to be irregular. Irregular is coming. Atrial fibrillation. You told? Atrial fibrillation, good. Atrial fibrillation, what happens? The rate is extremely high. In atrial fibrillation, rate is around, 180, 200 also. I have seen up to 220 also. It is also a life-threatening condition. But it's quite curable, okay? It's treatable. In atrial fibrillation, you will see very important thing, irregular heart rate. Heart rate is definitely irregular, but the extra bit is coming, that is also irregular. So this word, we use this terminology, irregular heartbeat. That is exclusively found in atrial fibrillation. That is very typical, okay, very typical of atrial fibrillation. Where do we get irregular heartbeat? That means heart rhythm is also irregular. So in that case, it is very difficult to calculate the heart rate by just looking at the RR interval, because RR interval will be less only. Why? If this patient has got heart rate, how much? Around 60, 70? If it has to be 200, that means RR interval has to be this much, isn't it? That number of big boxes will be around 2 or maybe 1.5. ऊपर में कितना होगा 300, 300 by 2 कितना होगा 150. So it is very difficult to interpret. Okay, this side clear? Any confusion? Should I repeat? Should I repeat? I will repeat if you want. Heart rate. Any confusion is there this side? Huh? Come. Okay. Atrial fibrillation. Atrial fibrillation, what happens? Heartbeat is very high. Okay. Heartbeat is irregular. Two things. Rate is very high, rhythm is irregular. When you say irregular, it's a rhythm. I told you, na, rhythm. It could be regular also, it could be irregular also. So in atrial fibrillation, heart rhythm is irregular. And very typical is irregularly irregular. If someone asks you, exam, no one is going to ask you. Even we are also not asked. But still, if you can answer, it's very good only for you in your clinical practice. No? So what is the diagnosis of an irregularly irregular heartbeat? Sorry, heart rhythm. That is called AF. Shortly we'll write AF. Okay, atrial fibrillation. Okay, any confusion this side? Anything you want? That is very difficult, you know, it's very difficult. Still, for that exclusively you will use consecutive 3-4 RI intervals. Okay. Still, you don't have to calculate the exact heart rate because that patient is not having the fixed heart rate of 220 anyway. It could be 200 also. It could be 250 also. Okay, so you just have to come to a conclusion that this patient is having abnormally high heart rate and this could be a case of atrial fibrillation. In exam, you will not be asked about the diagnosis. Okay, don't worry. No one is going about the diagnosis. Like they will give you an ECG, they will ask you what is the diagnosis. I can tell you 101%. No one is. In exam, you should know how to read an ECG. That is the most important thing. That is the thing, na? If the rhythm is irregular, RI interval will be different. कुछ RI intervals में number of big boxes will be 4 होगा, कुछ में 3 होगा, कुछ में 1 होगा. If the rate is very high, but we have one more condition when the rate of the heart is very less. Obviously, not necessary, na? Heart rhythm will be high only. Heart is not beating also sometimes, very less. Where? Where? Heart is beating less, 30-40 heart rate. What is the condition? Come on. Huh? No. No. Heartbeat will be less. You sinus bradycardia, 1 point. Very good. One more point. Sinus bradycardia. That is a physiological. Where do we get sinus bradycardia? Come on. You'll tell me. Where? Tell me conditions. Where do we get sinus bradycardia? Where? Tell me condition. ये very common. Nowadays तो और common हो गया ये. Physiological, normal condition यार. आपका भी हो सकता है मेरा. Tell me one condition. हैं? Depression में तो उल्टा है भाई. बोलो. Bodybuilders जो फुटबॉल खेलता है, जो athletes, you can write this down, this point. Physiological bradycardia, it is seen in athletes, football players, a muscle man, जो gym में जाता है वो वाला, जो big muscle है ना. How many of you go to gym? Let's raise hands. Don't feel shame. Come on. How many of you? Nobody goes to gym. That fellow one and no one from girls. Huh? Boys, you go to gym. You check your heart rate. You go to gym? Do you go to gym? Check your heart rate and tell me. I will tell you. Check your heart rate for at least 15 seconds. Okay? Count it. You also count. Count your heart rate for 15 seconds. And compare with your friend next to you. All of you count at least for 15 seconds. I will tell you the difference. How much you got? How much you got? 70 page. You 72. And how much you got? That fellow? How 1 minute में कितना होगा? Calculate करो. 88 something, no? 92. Anyway, see, those who are going to gym, they will have less number, okay? Around 70. Sometimes, if you are going to gym very vigorously, 2 hours, 3 hours, your heart rate will be as low as 60. As low as 60, even 55 also. I will tell you. So bradycardia means, less than 60. Less than 60 means bradycardia, and more than 90 means tachycardia. Bradycardia, you know na? Bradycardia, tachycardia, all of you, that side? Tachycardia means more heart rate, very high. Brady means low, ठीक है ना? Physiological bradycardia is seen in athletes. Just write this down. Why also I can tell you, again it will become more confusing for you. Why the heart rate is low in athletes, I can tell you. Should I tell you? It is because of the high vagal tone. We have got vagus nerve. Vagus nerve you have heard, na? Vagus nerve has got cardiac inhibitory action. It stops the heart, don't beat. So these athletes have got very high vagal tone. That's why they have got less heart rate compared to a normal. See, in normal individual you will see around 90, isn't it? 80, 90. But at least you will see around 60, 70. Okay. So that is called sinus bradycardia. So even if the heart rate is low, it has to be regular. Just remember this point. Physiological bradycardia is there in gym goers, but it has to be regular. That means heart rhythm has to be regular. It cannot be irregular. Your heart rate is, it could be 50 also. In sometimes in professional bodybuilders, they have heart rate like 50, 52 sometimes, okay? But their rhythm is normal. That is very important thing. Rate से भी ज़्यादा important rhythm होता है. Rate too it can vary ना. Some people may have 120 heart rate also. But most important thing is rhythm. If rhythm से कुछ problem हो गया, then it's trouble. So RRI interval, ठीक है? Suppose the lead 2 should be this whole strip like this, one peak, so that you can compare the consecutive RRI intervals. From one segment also you can say, see, number of big boxes divided by 300 divided by number of big boxes. Okay. See, in ECG you have small boxes also. Here you can't see. Can you see? You can't see there. You can calculate in that way also. One big box consists of 5 small squares, isn't it? Oh, it's also not there. I can see here, but not there. Can you see there? Huh? No. One big box consists of 5 small squares. That means if you say 300 divided by number of big squares, that means it could be 4 or 5. That is also one way, and one way also 1500. That means 300 into 5. Or below number of small squares. That is more confusing. Instead you go for the big squares. Above 300 and below how much? Number of large squares. Okay. We'll do some exercise. Okay. Can you tell this one? Lead 2. Just see the lead 2 only. Okay. Lead 2. Calculate the heart rate. Yeah, simple. Very simple. 300 divided by number of large squares. बोलो अभी कितना हार्ट रेट है? Isn't it? कितना है? बोलो. How much you got? How much? How much you got? This side? Heart rate can karo, count karo. Huh? Huh? I'm asking you to calculate now. How much? RR interval. 300 divided by number of boxes. कितना box है वहाँ पे? How many boxes are there? Huh? 8 boxes. कोई confusion है क्या regarding 8 boxes? No confusion ना? RR interval you know or not? That दो pic जो है वो this lead to. That is the RR interval. How many boxes? 8 boxes. What did I tell you? 300 divided by 8. What is that? Answer? How much? So why you are so confused here? Come on, 37 years, 37 only. So what is the diagnosis? Bradycardia, obviously. Now you tell me, sinus bradycardia or something irregular is there. Can you see any irregular? Just see the lead 2 only. It is not irregular, it's regular only. Kahan irregular hai? You can see the RR complexes, they are coming at regular intervals. Forget about the lead P3 and P5, just see the limb leads. Isn't it? They are coming on regular. Lead to only one complex, it's very short actually. Ideally it should be very long lead. Na? This is the case of sinus bradycardia. Where? That's why I'm telling you, na, this number of boxes is more. That means this is negative only. That's why I asked you to stick to this only. This is negative declination. We'll discuss about the axis. When we discuss about the axis of the heart, that's why only concentrate about the lead 2. The moment you are given an ECG in exam, just see the lead 2 when they ask you to calculate the heart rate. Just see the lead 2. Lead 2 is important for heart rate. Don't go the other leads. Okay, who confuse kare? Only you will get confused only. Just remember you have to see the lead 2, which is the most important. So here it is the case of sinus bradycardia. Here you can see the small squares also, isn't it? You can use this also, but it will be confusing. This is easier, na? Isn't it? It's very easy. 300 divided by number of large squares. Okay. In lead 2, in rhythm strip. Okay. So rate and rhythm is okay, ठीक है, no confusion. Rate or rhythm में any confusion है? Then we move on to axis, cardiac axis. No confusion. Rate you know how to calculate. Rhythm you know whether complexes are coming regularly or not. See in lead 2 when you are giving a long lead 2, okay, the strip has got long lead 2 means like 10, 12, okay, RR QRS complexes. Then if you see, by looking at the ECG only, you can say their complexes are coming regularly or not. If it's regular, then it's regular. If it's irregular, you tell the examiner, sir, the rate is this much, but rhythm is irregular. Okay, this patient has got heart rate of like 70, but the rhythm is irregular. But normally in 70 heart rate, rhythm won't be irregular. Rhythm will be irregular when the heart rate is abnormally high. Like I told you, AF, atrial fibrillation. Okay, in atrial fibrillation. Okay. Now see what is called cardiac axis. It is a little confusing also, tricky also, but you will understand if you give concentration. Okay, just take 1 minute break and read this. Just go through the lines. The axis of the ECG is the major direction of the overall electricity activity of the heart. It can be normal, left, right, or indeterminate. The QRS axis is the most important to determine. Okay. Now, you can write one small point. It is the QRS complex. We'll examine for the ECG, for the axis determination. Only QRS complex, nothing else. And limb leads, not the precordial leads. In exam, this will be asked. Okay. There are less chance that examiner will ask you about the cardiac axis. Still we will discuss. Okay, still we will discuss. But first they will ask you about the what do you see in cardiac axis. It is the QRS complex. And for axis determination, we'll examine the limb leads. That means lead 1, lead 2, lead 3, and the augmented leads, AVR, AVL and AVF. But not the precordial leads, okay? Never mention precordial leads. Cardiac axis. We have gone through red rhythm ho gaya. Now this is cardiac axis, okay? You see, oh, you can see there, na? Only precordial, on limb leads, only limb leads, not precordial leads. And AVR, AVL and AVF, okay? Total six leads we will examine, not the precordial leads, okay? Now see, QRS complexes can be positive, okay? They can be positive and they can be negative also. I told you in the first class, in the first part, that if it's above the isoelectric line, that is positive. Below means negative. Or you can say positive deflection or negative deflection, okay? Now you draw this. I will tell you what to draw. First make a circle. This is called ethovands, ethovands. This is simple, okay? This is very simple, I will tell you. First make a circle, make 4 parts, okay? 4 part karo.